Hello, everyone. I'm Dr. Piki Saxena. I'm a director professor in the Department of Obstetrics and Gynecology at Lady Hardinge Medical College, and I'm an executive member of the Indian Fertility Society. I'm also the national coordinator for a very important program, the Counsellor Empowerment Program, which has been rolled out by the Indian Fertility Society. And here with me, I have Professor Dr. Pankaj Talwar. Sir is the president, and everyone knows Sir very well.
Thank you.
So, welcome, sir.
Thank you.
So, sir, I would like to know that you have, I always call you a magician. You have created so many new programs, the nurses program, the youth empowerment program, self empowerment program, the AI Wala program. So, how did you think about this very different program, the Counselor Empowerment Program? Because nobody else, I think, in the country or in the world has thought of this unique and brilliant idea.
So, Dr. Piki, I'm from the government myself, like you. And we've been working from nearly 30 years in the field of fertility or as a gynecologist. I think the most important organ in the body, which is worth preserving, but very weak, is the brain. I think something lying here in our skull, which is so soft and full of fat, operates on a very less battery charge, but runs the whole body. As I tell that, our mind is full of thoughts all the time. Our mind is so much fluctuating, and now in the modern world, with so much of dopamine surges for everything, our mind is going out of control. So I always feel that we have to control our mind. And when we come to fertility practice, it's the mind. We talk about drugs, we talk about giving them intact protocols, agonist protocols, but I think till the time our hypothalamus and amygdala are not in control, I think we really can't move forward. So I think I always say that we have to control our amygdala, reticular activating system, and our HPO axis. And these are controlled by our thoughts. I always thought that I was a bit aberrant in my thinking, but then so grateful to Government of India. Look at our guidelines which they brought out. They just look at our notifications of 7 June or 21st of June for surrogacy. They have made a counselor as an integral part of the management. I think when you look at it in the whole totality, they have got a gynecologist, it's compulsory. And then I think after embryologist, the third person is a counselor. As a doctor, we're very fond of operating and talking. But when it comes to talking to a patient, and I think we should be like a little sponge and taking away all their negativity, which we can't do because we're too busy in our regular work. That's number one. So we do employ counselors. And I remember in the army when we had a counselor. So this girl, her name was Aisha. She used to make people draw little parrots and pigeons and trees and look into their mind. We used to do some sort of meditation and yoga to cool the mind. I think we have to soothe the mind of the people who come. They're very disturbed. And we always talk about training a gynecologist, training an embryologist. I think very important is to train a counselor who are the actual healers. Leave aside patient picking. I think even you would have thought many times that you need counseling because we also go, we got billions of neurons which are firing throughout the day. Billion neurons. I think so many neurons and capillaries that it can go around the moon 4 to 5 times in one brain. And we are left devastated in the modern world. So I thought what to do to soothe the practice. And we are going by the laws. The government says that we should have a counselor
Definitely.
too. So I think this was my dream, and I had to pick up somebody to help me, and you were the golden girl. So many gold medals. I thought you're the right person to pick it up. So I think I called you up and you agreed. I think what you have done is unparalleled, and counseling is a part of our mainstream. You, Dr. Poonam Nair, the way you have went ahead, engaged so many foreign counselors. It's a great job you have done. So I want to ask you one question here, ma'am.
Yes.
How did you execute it? Because I had an idea that we should bring. Now, when I speak to you, 400 counselors you've got in your group. 400 काउंसलर को एक ग्रुप में लेकर आना, उनको मैनेज करना, उनका टेक केयर करना, एंड दे आर नॉट MBBS. Majority of them may not be MBBS.
Yeah.
So how do you regulate their working? How do you execute their work? I mean, I can say I can only dream of things, but you are on the ground fighting every day. And I saw you having a lot of battles of your own when you were. I think you required counseling many times to counsel
Yes,
the
sir.
counselors.
I used to call you so many times.
How did you
and-
handle it? It's a lovely program
Yeah.
on behalf of IFS. We have done it. We are nothing without our parent body, IFS. How did you handle it?
Sir, first of all, I would really like to thank you to have so much confidence in me that I can do it. I still remember the day when sir had called me in the evening and he told me about the intentions of starting this program, why he wants to do it, and I was really amazed. And it was a very big challenge for me. I had no idea whatsoever how to execute it. So the first challenge was that I talked to many of the counselors in different IVF centers, but what I came to know was that there were very few trained counselors.
Trained counselors.
Half of them are just office staff or some nurse or some receptionist. Even some doctors were doing it. So it was a very difficult task. And there were no legal or, curriculums to train even the psychologists in ART. So under your guidance, we thought about it, and then we built a very strong team. The team consisted of very much trained and experienced counselors, ART specialists. We had Dr. Poonam Nair with us, who is a renowned counselor and a psychologist. We had Dr. Geeta Khanna, madam, who is a very experienced ART specialist. And we built a team, sir, from both private sectors and government sectors. And we had also a embryologist with us. And slowly we had people from outside India, people with AI specialization who also helped us in this. So we all built a team.
I believe you got a website and chatbot too.
Yes. So
how is the chatbot? How does it look?
The fertility support website is a beautiful website.
Yeah, it is.
Which has been built by the AI engineer from our team. And it has a chatbot.
She's based in USA?
She's based in US.
USA, yeah.
Yes.
How does your chatbot look like? How the chatbot looks on the screen?
It looks like it doesn't look very great, but you ask questions and it answers.
Super.
It just
super,
answers.
super.
And this was, sir, about 1 year back when it was very, very new.
And that
I
too in
did not
counselling.
know. That too for counseling.
And we are lacking such things in
Innovative
clinical
things.
practice. But
Yes.
in counseling, you got AI embedded. So
Yeah.
when you had told me, I was quite shocked. But I said, देखते हैं golden girl क्या करती है, और कर दिया. Super.
तो सर उसमें अपने क्वेश्चंस डालने में दैट आंसर्स एंड वी हैव गिवन लॉट ऑफ जेन्युइन रिसोर्सेज all the websites, good papers on counseling. So it is giving reliable answers.
Absolutely.
It's not like ChatGPT. I was thinking, what is the difference between this one and ChatGPT? So I put questions in both, and the reliability of our chatbot and our website is quite authentic.
Super.
And it has been, the ART specialists and counselor have both said that this is quite reliable.
Good.
And it is a very useful website. And sir, we also brought about
Lovely
this book.
Yeah, it's a beautiful book you brought out, and very comprehensive book.
Very comprehensive. And it is a ready reckoner. So we decided that first the counselors, they don't have the medical knowledge.
Thank you.
They do not have the medical knowledge also, although they are trained in psychology. So it is very important to tell them about the laws and the legalities and the regulatory needs of the country. So they have to be aware of that. And we also gave them some basic knowledge about the medical procedures. And side by side, we clinicians, as you have also worked in the public sector, we have so many patients. Patients are so emotionally fragile and they need to talk to somebody. The doctors are so busy. So if we have the counselor, they are going to do the hand holding and help them in the continuous journey. So that was the motive.
But beautiful book, Picky, and very nice rectangle you have created. आपको लगता है कि जो आपने इनिशिएटिव लिए, they are actually going to the patients, are the people getting benefited? Are people जो आप पढ़ाते हैं, जो आप उनसे सीखते हैं, is it reaching people? Is it changing somebody's life, or it is just in a book or on the website?
सर, तो इसके लिए हमने काफ़ी सारे एक्सपेरिमेंट्स किए. We used to take some case summaries and role plays were there.
Role-playing.
And we have also tried it in the public forum programs also, which I've conducted in Lady Harding, and also in different ART clinics in the private sector also. तो बहुत सारे बदलाव हमें करने पड़े एंड इसको बार बार देख के आपस में डिस्कशंस करके, लॉट ऑफ वेबिनार्स, लॉट ऑफ जूम मीटिंग्स, लॉट ऑफ सेमिनार्स एंड रीडिंग थिंग्स, रीडिंग केस समरीज वाज वेरी वेरी यूजफुल. और फिर जो काउंसलर्स इसमें ट्रेन हो रहे थे, वी टुक देम अबोर्ड एंड वी आस्क्ड देम टू शेयर देयर थॉट्स एंड हाउ डिड दे फाइंड इट यूजफुल और नॉट. So I think it has been a very nice journey. We learned so many things. There are so many techniques. How to, evaluate whether a person needs normal counseling or there are some red flags when we need to refer them. So all those things, we have some very nice toolkits, patient performers, checklists, and some of the tools to हेल्प द पेशेंट्स. काफ़ी सारे हमने पोस्टर्स और काफ़ी सारी चीज़ें इसमें क्रिएट की हैं. और फिर पेशेंट सेटिस्फैक्शन टूल है इसमें इन बाइलैंग्वेल, इंग्लिश एंड हिंदी.
I can see it given in Hindi also.
Yes,
So it's very
हिंदी
beautiful thing you
also.
have done.
क्योंकि हमारे मरीज़ जो अस्पताल में आते हैं गवर्नमेंट सेक्टर में, दे आर नॉट वेरी वेल वर्स्ड इन इंग्लिश. सो वो कंफर्टेबल रहें, इसके लिए हमने ये भी डेवलप किया.
Super. How big is your team?
I have two mentors. I've already told Dr. Poonam Nair is the psychologist head, and Dr. Geeta Khanna madam is a very, very renowned and experienced ART specialist. Along with that, we had 6 teams and each had 5 members. So out of that, there were 2 clinicians and 3 psychologists. And the psychologists were not only from Delhi, all over the country. And that was how we also had an embryologist, क्योंकि embryologist का perspective भी बहुत ही important है. How they counsel, how do we integrate, एक patient को बताना, bad news break करना is so traumatic even for us, and how the patient takes it up. They feel totally helpless, they are so anxious, they get depressed, they just break down. So at that time, holding their hands, गिविंग देम क्लियर इन्फॉर्मेशन एंड रियलिस्टिक इन्फॉर्मेशन. उस समय सिर्फ ये बोल देना कि अगली बार हो जाएगा, दैट्स नॉट इनफ. दे मे हैव फेलियर अगेन. सो हेल्पिंग देम टू टेक अ शेयर्ड डिसीजन. एंड इसमें एक चीज़ और है कि जब हम इतने अच्छे से उनको एम्पैथी और नॉलेज और इन्फॉर्मेशन देते हैं, तो दे आर ऑल्सो एम्पावर्ड. As you were saying, it is not just the physical well-being, the emotional and psychological and the financial drain of their money. कितने लोग सर सब कुछ बेच के अपना हमारे पास आते हैं और उनको फिर बता देना कि एम्ब्रियो डेवलप नहीं हुआ या एम्ब्रियो ट्रांसफ़र के बाद यू आर नॉट प्रेग्नेंट. इट ब्रेक्स देयर हार्ट. सो helping both the husband and wife, bringing them together, it really gives you a lot of satisfaction. It empowers the patient, her family. So
patient. आपको लगता है that even we need counseling?
Yes.
How do आपने जब सबसे बात किया and you ran the program, do you think the doctors also need counseling and they need to be spoken to?
Absolutely, sir. We all need counseling. So many times we feel helpless. There are internal घर की problems हैं, institute की problems हैं, communication problems हैं. There are so many problems. I think when we are living, there are going to be ups and downs.
Ups and downs.
And we really need the doctors especially, and especially the woman gynecologist. We really need a lot of counseling, lot of support.
Men too.
Men too, definitely.
So, Vicky,
that is why, sir, you thought of this idea, not me.
I think I was the culprit behind it. So,
Yes,
so thank you
yes.
so much, Vicky, and lovely talking to you. Any message for the audience you have? And where do you look at this program in the coming few years?
So I think the program started by by the Indian Fertility Society. It's a very, very important program, and we need to percolate it down to each and every ART clinic. Even the infertility specialist should know, and we have to be more empathetic. We need to spend more time with the infertile couple, क्योंकि हर एक every woman wants to conceive, want to have a baby, and when they are not able
And the
to,
men?
and the men too.
Men too.
And sir, the important
And how about, I think I always feel that mother-in-law, father-in-law.
Mother-in-law and father-in-law.
It's a huge complex situation.
Definitely.
Not only in India, I think all over the world.
everywhere.
The urge to be a grandparent or the urge to be Masi or any other relationship, I think is there everywhere.
They just stop going everywhere. There is social boycott, if the woman is not getting a baby, as you have yourself experienced. So it's a real, difficult social, financial, psychological, medical problem. And we need to be more empathetic. We need to be more sensitive for this problem.
So I think thank you so much for this. And I think we always talk about sympathetic. We have to be more compassionate. But I think we all have to be parasympathetic because we have so much of inputs coming into us that we are always, somehow we have got a lizard brain. We want to respond to whatever comes to us. I think we need to activate our parasympathetic system. So you must visit Vicky, take her counseling. And I think we have got a lot of programs which I have put on the YouTube.
Yes.
How many programs would you have done?
We have done about 8 episodes in which we have, as I discussed, we have taken special cases like if the uterus is absent, PCOS, patients who are having malignancies, who need fertility preservation. What are the social problems, the psychological problems they deal with? All those things we have taken.
Super.
And male infertility. That is a very, very important thing and a big challenge. बिकॉज जैसा आपने बोला सास जो है और जो भी फैमिली है दे आर कॉन्सेंट्रेटिंग ऑन द वुमन कि इसका नहीं हो रहा है एंड द मेल इज बीइंग नेग्लेक्टेड एंड सर द ऑल्सो वी हैव अ प्रॉब्लम दैट who is going to treat the male infertility? We gynecologists are being trained to treat the female infertility. The urologists are not trained in reproductive endocrinology. So I think we need to give importance to the male partner also. They also have a very sensitive and a very important equal role. So there has to be, सिर्फ औरत ही बेचारी नहीं है. We have to take care of our male partners also.
Save the man, save the man.
Yes.
So thank you so much, Dr. Picky. I think you've done a great job and the whole team has really outshined everyone. And I think you play a very important role in shaping not only the lives of the people, but I think the future also. So thank you so much and I wish you all the best.
Thank you so much, sir. Thank you very much. Jai Hind, sir.